So first, what is hypertension? First, what is hypertension? Hypertension is the increase either diastolic or systolic BP or both of it. So what is the normal BP? It is different for different human being depending upon the comorbidity. But primarily we can say that if SBP is less than 120, DBP is diastolic BP is less than 80, it is a normotensive patient. Clear? Then there is a stage called pre-hypertension. Pre-hypertension means it is not normal or high normal, but it is not in hypertension. So no drug or modification, lifestyle modification is required, or only lifestyle modification can bring it to the normal stage. Clear? So it is pre-hypertension. কি হলো বাবা? এতজনের কাছে একসাথে? Then stage 1 hypertension. Stage 1 hypertension, it is SBP 140, more than 140, less than 160. Similarly, DBP more than 90 but less than 99 or less than 100. More than that, it is stage 2 hypertension. It is stage 2 hypertension. Then there is a hypertensive emergency. Hypertensive emergency when SBP is more than 210 or DBP is more than 120. Clear? So before going to the treatment proper, when what drug to be given, we have to understand that what is hypertension. Hypertension, if it is more than 140 or DBP more than 90, but it is not for a single, at least for 3 times. At least for 3 times. Before starting the medication. After that, what are the drugs? What are the drugs? As a part of long question or in Viva, what are the, name some antihypertensive. Name some antihypertensive. Then you have to say that there are first line antihypertensive and second line antihypertensive. What are the first line antihypertensive? You have to remember what are the first line antihypertensive. It is A, C, D. A for AC inhibitor and angiotensin receptor blocker. C for calcium channel blocker and D for diuretics. Very good. Now which type of, you have to remember which type of CCB. CCB, what are the common CCB used for hypertension? Louder please. Amlodipine. Dihydropyridine group of calcium channel blocker. So which are not used in commonly, which calcium channel blockers are not commonly used as a first line antihypertensive? Verapamil and diltiazem. Where it is used? It can be used in angina or arrhythmias. Clear? So name some antihypertensive, first line antihypertensive, AC inhibitor, ARB, calcium channel blocker. Not all calcium channel blocker, but all type of AC inhibitor and ARB are antihypertensive. First line. Then CCB. Not all CCBs are the first line antihypertensive. Which one? Amlodipine, nifedipine, dihydropyridine group. Which are not the first line antihypertensive? As among the CCB, verapamil, diltiazem. Where it is used? Angina and arrhythmias. And then the third one, diuretics. What are the different types? Diuretics completed, covered. Which type of diuretic primarily used for hypertension? Thiazide. Very good. Thiazide. What are the role of loop diuretics in hypertension? In hypertension. You have to understand the question. What are the role of loop diuretics in hypertension? If there is a hypertensive emergency, we can give intravenous furosemide. Other than that, in which CVS condition furosemide is drug of choice? Pulmonary edema, or another term is left ventricular failure. In left ventricular failure, the drug of choice or diuretics of choice is IV furosemide. In case of hypertension, diuretic of choice is, in hypertension, thiazide. Clear? So where we commonly use potassium sparing diuretics, what are the use? It is not the use, it is second. First one is edema or ascites due to cirrhosis of liver or decompensated liver cirrhosis. If there is a edema, we prefer spironolactone. So now what are the other types of diuretic? তার তিনটে হয়ে গেল, thiazide, furosemide and spironolactone. What are the others? Carbonic. Very good. Where it is used? Very good. Another? Glaucoma. Next, osmotic diuretics. Name? Where it is used? বাড়াতে না বেড়ে থাকলে দেয়. If there is a increased intracranial tension, even in glaucoma we can use. Clear? What are the different uses of diuretics? And what are the diuretic of choice for hypertension? Thiazide. So what are the first line antihypertensive? ACE inhibitor, ARB, all ACE, ARB, dihydropyridine group of calcium channel blocker, thiazide group of diuretic. Other than that, there are drugs which are used when first line drugs and combination of first line drugs is not able to control adequately, then we go for the other drugs. What are the other drugs? Alpha blocker, beta blocker, centrally acting agents, sympatholytic agents like clonidine, methyl dopa. Clonidine, how it acts? Clonidine to পড়ানো হয়ে গেছে. Agonist. So how it can help in hypertension? কোথায়? Location? CNS. Clear? So clonidine, methyl dopa, where it is used? Methyl dopa, ওটা levodopa. Methyl dopa, hypertension in pregnancy. Hypertension in pregnancy, we use methyl dopa. What are the other drugs that can be used in hypertension in pregnancy? এগুলো সব পড়ানো হয়ে গেছে. ড্রাগের নাম বললে তুমি বুঝতে পারবে এটা পড়ানো হয়ে গেছে. ল্যাবেটোলল কোন গ্রুপের ড্রাগ? আলফা প্লাস বিটা ব্লকার. পড়ানো হয়েছে? তার ইউজটা কোথায় সেটা পড়তে হবে তো. Short question can come as a labetalol. Where it is used primarily? It is used primarily in pregnancy induced hypertension or hypertension in pregnancy. So hypertension in pregnancy, drugs used are MCQ. For MCQ, you have to remember at least two drugs. What are they? Labetalol, it is now first line drug for hypertension in pregnancy, and next is methyl dopa. What are the other group of drug can be used? Calcium channel blocker, nifedipine, nicardipine can be used. Which drug cannot be used in pregnancy induced hypertension, though it is an antihypertensive drug? ACE inhibitor, ARB, and diuretics also. So among the first line drugs, only calcium channel blocker can be used in pregnancy, hypertension in pregnancy or pregnancy induced hypertension. Clear? এই পর্যন্ত। And then there is a group called vasodilator. In vasodilator there are three groups. For as a antihypertensive we can use two groups. So one is which group, which vasodilator cannot be used, which are primarily and only vasodilators, namely nitrates. Very good. That cannot be used only for hypertension. Clear? Why? They can pull the blood and there may be a reflex tachycardia. Reflex tachycardia is also present when there is a primarily arteriolar dilators. Primarily arteriolar dilators are hydralazine, minoxidil, fendolopam. Among these, minoxidil, where it is used commonly, here goes alopecia, and sodium nitroprusside. It is artery plus vasodilator. Both dilate artery and vasodilator. It is used in hypertensive emergency. So what are the drugs that can be used in hypertensive emergency? Nitroprusside, IV furosemide. Then if there is any intravenous, that is called enaraprelate, not enarapril. It is enaraprelate, intravenous enaraprelate. And sometimes sublingual calcium channel blocker like nifedipine can be used. So two routes can be used in case of hypertensive emergency. What are they? Primarily intravenous, nitroprusside, even nitrate can be used if we can exclude there is no hemorrhage in the CNS. Okay, and third one is IV furosemide, then enaraprelate, and sublingual nifedipine can be used. So these are the drugs. So what are the first line drugs? What are the drugs used in hypertensive emergency? What are the drugs used in hypertension in pregnancy? And what are the second line drugs? Clear এই পর্যন্ত? Next, before giving any type of medication in pre-hypertensive stages, we can, or even in the hypertensive stages, we have to maintain this modification, that is weight loss or weight control, salt restriction, sodium restriction. Then there is a aerobic exercise, moderate alcohol consumption. If it cannot be stopped, moderate alcohol consumption. Clear? So first, ACE inhibitor. How it acts? Mechanism of action of ACE and ARB. ACE and ARB as a antihypertensive. How it can act? So first, angiotensinogen is synthesized in liver. They converted to angiotensin 1 by renin, and renin synthesized in JG cell, and it is present in kidney. After that, angiotensin 1 converted to angiotensin 2 by the help of ACE, angiotensin converting enzyme. Where it is present? Primarily lungs. Clear? After formation of angiotensin 2, the actions of angiotensin 2 are first increase sympathetic activity. Sympathetic activity বাড়লে কি হবে? Alpha and beta both are stimulated. The peripheral constriction ও বাড়বে, peripheral vascular resistance বাড়বে. Similarly, এটা কার জন্য হয় peripheral vascular resistance? আলফা না বিটা? আলফা, কোন আলফা? 1, ঠিক আছে, এত 1 পর্যন্ত থাকুক। আর কার্ডিয়াক আউটপুট কার জন্য বাড়ে? বিটা 1। ভেসোডাইলেটেশন কে করে? বিটা 2। আলফা 2 কি করে? আলফা 2 এক্ষুনি বললে অ্যাগনিস্ট কে? আলফা 2 অ্যাগনিস্ট clonidine কোথায় present? Presynaptic in CNS. Clear? So it increase sympathetic activity that increase peripheral resistance and cardiac output. তাহলে hypertension বাড়াবে না কমাবে? Angiotensin 2 hypertension বাড়ায় না কমায়? বাড়াবে, both by increasing constriction and increasing cardiac output. Clear? Then sodium and water retention. Third one, if sodium water retention হয় তাহলে কি হবে? Hypertension বাড়বে. Similarly, they release aldosterone that also helpful for sodium water retention. Third point. Fourth point, they have a direct arteriolar constriction. তাহলে কি হবে? Arteriolar constriction হলে কোনটা বাড়বে? পিরিয়ড না আফটার লোড? হ্যাঁ, আফটার লোড বাড়বে। এন্ড হাইপারটেনশনে কোন জায়গাটা বাড়বে? হাইপারটেনশনের ক্ষেত্রে ইট ইজ ইনক্রিজ পেরিফেরাল রেজিস্ট্যান্স। ক্লিয়ার? এন্ড থার্ড ওয়ান, দে অলসো সিক্রেট এডিএইচ। এডিএইচ বাড়লে কি হবে? সেই ওয়াটার রিটেনশন হবে। তাহলে অল দিস ফ্যাক্টরস এফেক্টেড বাই angiotensin 2 that lead to increase blood pressure. Clear? So we can have 3 points where we can reduce synthesis or action of angiotensin 2. What are they? Number 1, if we inhibit renin, direct renin inhibitor. Direct renin inhibitor ki aliskiren. Then 2, inhibit ACE enzyme. Then ACE inhibitors, angiotensin converting enzyme inhibitors. And third one is the receptor, where the angiotensin 2 acts. So receptors are blocked, so angiotensin 2 cannot be effective. Clear? এই পর্যন্ত mechanism of action of ACE ARB renin inhibitor in hypertension. আরেকবার বলবো, how ACE inhibitor, ACE inhibitor এর নাম কি? ব্লকারের নাম losartan. How they act in hypertension? কোশ্চেনটা তো এটা আসবে, mechanism of action of losartan in hypertension. Block করে। Then what will be the effect? They reduce all these things caused by angiotensin 2. কি? Sympathetic activity, sodium water retention, secretion of aldosterone that also helpful for increased sodium water, then direct arteriolar dilatation and ADH secretion. All 5 these effects is counteract by the blocker as well as ACE inhibitor and direct renin inhibitors. Clear? Mechanism of action of ACE inhibitor ARB as a antihypertension. হবে তো? এটা লেখা যাবে তো? But you have to remember, direct renin inhibitor is not a first line antihypertensive. First line antihypertensives are ACE inhibitor ARB, which type of? Dihydropyridine group of calcium channel blocker and diuretics. Among these diuretics, thiazide is the first line. Clear? Mechanism of action of renin angiotensin inhibitor. So these are the drugs we can use in this. Then calcium blocker. Calcium blocker, there are primarily 2 types of calcium channel blockers. One that affects in periphery, another one that affects centrally, means in cardiac tissue. So diltiazem as well as verapamil, they block the calcium channel present in the heart, SA node, AV node. They regulate primarily the vasodilatation of coronary vessels as well as the rhythm, SA node, AV node. But they cannot helpful primary for the first line antihypertensive. First line antihypertensive are nifedipine, amlodipine. How they act? Mechanism of calcium channel blockers, as an antihypertensive. So they block the influx of calcium in the smooth muscle of peripheral vessels, primarily arterial and venules. So if there is a less calcium inside the smooth muscle, what happen? The contractility will be less. As there is a less amount of contractility, ki hobe tale? Total peripheral resistance will be less, hypertension will be less. So how calcium channel blocker, which one is used for as an antihypertensive? ACE inhibitor, ARB. Then diuretics. Among these diuretics, though loop diuretics is helpful, the first line, if anyone asks what is the first line diuretics, or first, only if you ask for one diuretic to name as an antihypertensive, it is thiazide group of diuretics. They reduce volume of water and sodium from the body. That can be come into the normal position after few days. But the base level of sodium as well as calcium present in the smooth muscle of the peripheral vessels will be less if we use for continuous period. বুঝতে পেরেছো? সোডিয়াম ওয়াটারটা প্রথমে বার করে দিচ্ছে, that affects the primary reduction of the blood pressure, but after chronic use what happen? It will also reduce the sodium as well as calcium concentration inside the smooth muscle, and that reduce the contractility of the peripheral smooth muscle, and that lead to peripheral smooth muscle এর যদি contractility কমে যায়, total peripheral resistance will be reduced. So this is how this thiazide group of drug can be helpful in case of hypertension. Loop diuretics, where it is used? Primarily, if we try to reduce the blood pressure very rapidly, this high ceiling, high amount of water and sodium will be excreted in a short time. That means in hypertensive emergency, or if hypertension associated with heart failure, left ventricular failure, pulmonary edema, then they can helpful to reduce both of these. Clear? But if which one is the primarily used? It is thiazide group of drug. Next, beta blocker. How beta blocker acts in hypertension? First, classify beta blocker. Beta blocker এর নাম বলো কয়েকটা, কি beta blocker আছে? First, cardioselective, cardio non-selective. You have to always say like that. Cardioselective, non-cardioselective. Cardioselective beta blocker এর নাম বলো? Atenolol, metoprolol, bisoprolol. আর non-cardioselective beta blocker, propranolol আর timolol. Where it is used? Glaucoma. Betaxolol. So there is another question for beta blocker. What are the cardiac use? What is non-cardiac use of beta blocker? You have to remember that. What are the non-cardiac use of beta blocker? Non-cardiac use of one is glaucoma. Next, thyrotoxic. Very good. How it acts? It inhibits the peripheral conversion from the T4 to T3. So symptoms will be reduced. Next, anxiety, tremor, stage frightening, all these are reduced. So what are the non-cardiac use of beta blocker? Ar bolo? Prophylactic for migraine. Very good. Prophylactic of migraine bolte hobe, not treatment of migraine. Prophylactic of migraine. Treatment of migraine কি drug? সুমাট্রিপটান। আচ্ছা, ওটা কিসে কাজ করে? কোন রিসেপ্টরে? 5-HT2 1B 1D agonist na antagonist? Agonist. Very good. So how beta blocker acts in hypertension? বিটা ব্লকার ইজ ইউজ, কার্ডিয়াক ইউজ অফ বিটা ব্লকার কি কি হয়? কার্ডিয়াক ইউজ কি কি বিটা ব্লকার? বিটা ব্লকার হাইপারটেনশন, আমি বলছি হাইপারটেনশনে ইউজ হয় তো, হয়তো। নেক্সট ওয়ান অ্যারিথমিয়া, কোন ক্লাসে? ও অ্যারিথমিয়া পড়ানো হয়নি, অ্যারিথমিয়া ইউজ হয়। নেক্সট আর কিসে হয়? চারটে জিনিস আছে তোমার পরীক্ষায়, একটা হচ্ছে হাইপারটেনশন, অ্যানজাইনা, মায়োকার্ডিয়াল ইনফাকশন, অ্যারিথমিয়া আর হার্ট ফেলিওর। এর পাঁচটা ইউজ হয় না কোনোটা ইউজ হয় না বিটা ব্লকার? হাইপারটেনশনে ইউজ হয়, অ্যারিথমিয়া ইউজ হয়, অ্যানজাইনায় ইউজ হয়। এগুলো তো বিটা ব্লকারে পড়ানো হয়েছে, এখনকার বলছি না, বিটা ব্লকারে তো পড়েছো। হয়, ভ্যারিয়েন্টে হয় না, ঠিক আছে। আর লাস্ট ওয়ান হার্ট ফেলিওরে কনজেস্টিভ হবে। হার্ট ফেলিওরে কি হয়? হার্ট পাম্প করতে পারছে না, সেখানে বিটা ব্লকার দিচ্ছি, বিটা 1 ইনহিবিট হবে, তাহলে কি হয়? কন্ট্রাক্টিলিটি বাড়বে না কমবে? ইউজ হয় না হয় না? ক্রনিকটাতে হবে। বইতে লেখা আছে কিন্তু যে হার্ট ফেলিওর ইউজ হয়, নট ইন অ্যাকিউট কনজেস্টিভ কার্ডিয়াক ফেলিওর। অ্যাকিউট কনজেস্টিভ কার্ডিয়াক ফেলিওরে কি ড্রাগ দেবো তাহলে? ফ্রুসেমাইড। আর যদি আমাকে স্টিমুলেট করতে হয় ডোপামিন, ডোবিউটামিন দেবো, বাট নট বিটা ব্লকার। বিটা ব্লকার ইজ ইউজড ইন স্টেবল ক্রনিক হার্ট ফেলিওর, স্টেবল ক্রনিক হার্ট ফেলিওর, ঠিক আছে? তাহলে পাঁচটা জায়গাতে ইউজ হয়, কিন্তু ট্রিকি। সো হাউ ইট অ্যাক্টস ইন হাইপারটেনশন। হাইপারটেনশনে কিভাবে কাজ করে? বিটা ব্লকার, বিটা 1 বিটা 2, বিটা 1 বিটা 2, তাই তো? বিটা 1 কোথায় কোথায় প্রেজেন্ট? হার্টে আর কিডনি। হার্ট, ইফ দে ব্লক বিটা 1 ইন হার্ট, হোয়াট হ্যাপেন? হার্ট রেট কমবে, কন্ট্রাক্টিলিটি কমবে, কার্ডিয়াক আউটপুট কমবে। There is no effect in peripheral resistance. If it is effect, it is dilated years. Why? Periphery তে কি আছে, বিটা 1 না বিটা 2? বিটা 2. If it is blocked, then there will be, they can produce hypertension. So never write down that it blocks beta 2 as an antihypertensive drug. Clear? So beta 1 present in the heart and Golgi cell. So beta 1 in heart, if it is blocked, what happen? Cardiac output will be, heart rate and cardiac output will be less. If it is less, there will be reduced hypertension. Similarly, number 2, you have to write down. If you only write down the beta 1 in heart, it is blocked, and that reduce the hypertension, you will not get more than 50%. Clear? The second point is, it also block the beta 1 present in the Golgi cell. Why? They block the beta 1 in the Golgi cell, that reduce renin secretion. As they reduce renin secretion, the RAS system is less stimulated or non-stimulated. So they are also helpful for reduce sodium water retention, aldosterone synthesis, ADH release, all these will be reduced. So you have to write down at least 2. Kiki? One is beta 1 present in the heart, reduce heart rate and cardiac output, resulting into reduced hypertension. There is no effect on total peripheral resistance, because peripherally beta 1, not beta 1, but beta 2 is present. And second one is that by blocking the beta 1 present in the Golgi cell, they reduce or depress the RAS system. In one term, RAS means renin, angiotensin, aldosterone system. It is not stimulated or it is blocked. So how beta blocker acts in hypertension? Clear এই পর্যন্ত? বিটা ব্লকার ইন হাইপারটেনশন লিখতে পারবে তো? আলফা ব্লকারের নাম বলো। প্রাজোসিন, ফেন্টোলামিন, ফেনক্সিবেনজামিন. How it acts in hypertension? এগুলো সব পড়ানো আছে বলে আমি how it acts. Alpha 1 present in কোথায়? Peripheral blood. So if it is blocked, what happen? Total peripheral resistance will be less. So that leads to reduce hypertension. Clear? এখান থেকে আগে এক দু তিনটে কোশ্চেন হয়েছিল phenoxybenzamin where it is used primarily. Very good. So in the pheochromocytoma, which drug is preferred, alpha blocker or beta blocker? There is no role of beta blocker. Is there any role of beta blocker? The catch is that we can use beta blocker. We can use beta blocker in pheochromocytoma, but not before the alpha blocker. Why? Explain why. Why we should not use beta blocker? Why we should not use beta blocker as a first line antihypertensive? Why we should not use beta blocker? I thought beta blocker is a very good drug. Then why we should not use as a first line antihypertensive? First line antihypertensive এর মধ্যে beta blocker নেই, নেই তো? Why? তার একটা পয়েন্ট হচ্ছে why it should not be used in first or before alpha blocker in case of pheochromocytoma. Why? হ্যাঁ শুনতে পাচ্ছি না, জোরে বলো। কেন কেন? So if we very good, if we selectively block beta receptors, where it is present? Beta 1 heart আর beta 2 তে পেরিফেরিতে, এগুলো যদি আমি ব্লক করে ফেলি কি হবে তাহলে? All alpha receptors are open. Alpha 1 is present in the periphery. So all the neurotransmitter, adrenaline, noradrenaline, go and stimulate the alpha 1. And what will happen if there is a stimulation of alpha 1? Patient is already in hypertension, and that lead to a hypertensive emergency that can lead to end organ damage. What are the three main organs that can be damaged in the hypertensive emergency? যদি হাইপারটেনশন হয় তিনটে জিনিস দেখা হয়। একটা ব্রেনে কি হতে পারে? হেমারেজ হতে পারে, স্ট্রোক হতে পারে। নাম্বার 2 হার্ট, কি হবে? লেফট ভেন্ট্রিকুলার ফেলিয়ার হতে পারে। মায়োকার্ডিয়াল ইনফাকশন হবে না, কিন্তু কি হবে? লেফট ভেন্ট্রিকুলার ফেলিয়ার। মায়োকার্ডিয়াল ইনফাকশন হয় ডিউ টু করোনারি আর্টারি ব্লকেজ, বাট লেফট ভেন্ট্রিকুলার ফেলিয়ার। And third one, that can lead to papilledema. Papilledema, আইতে দেখে papilledema. These three primarily say, and fourth one is that there may be acute renal failure also. That can be the fourth one. Papilledema, that will lose eyesight, but life threatening will be number 1, it can affect CNS, heart and kidney. Clear? So why alpha blocker is given before beta blocker in case of pheochromocytoma? Why beta blocker is not given as a first line drug, especially in pheochromocytoma? Clear এই পর্যন্ত? কম্বিনেশন ড্রাগ কি আছে? ল্যাবেটোলল। ল্যাবেটোললে কোথায় ইউজ হয়? ল্যাবেটোলল হাইপারটেনশন ইন প্রেগন্যান্সি। আর কি ড্রাগ ইউজ হয়? আর হ্যাঁ নিফেডিপিন, ক্যালসিয়াম চ্যানেল। আর 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 কোনটা ইউজ হয় না? এসি ইনহিবিটর এন্ড ডায়োরেটিক্স। এসি ইনহিবিটর এন্ড ডায়োরেটিক্স ক্যান নট বি ইউজড ইন প্রেগন্যান্সি ইনডিউসড হাইপারটেনশন। সিম্প্যাথো সেন্ট্রালি সিম্প্যাথো, তাহলে যদি বলে অ্যান্টি sympatholytic antihypertensive drug, MCQ, for MCQ purpose, it combines with the centrally acting like methyl lopa, like clonidine. It is antihypertensive, sympatholytic drugs that can be used as an antihypertensive. Then alpha blocker beta blocker and alpha plus beta blocker. Why it is important? It can be given as a MCQ. Understand? Methyl dopa, clonidine, along with some beta blocker. You have to remember, not all beta blocker are the antihypertensive. Suppose among these they give an option of timolol, give an option of sotalol. Sotalol is a antiarrhythmic drug, not used as an antihypertensive. That is the catch. Because it is LOL, it is a beta blocker and it is antihypertensive, it is not like that. You have to remember, among the other option, if there is a centrally acting alpha 2 agonist like methyl dopa and clonidine, it is surely antihypertensive. You have to remember that sotalol, timolol, not all beta blockers are antihypertensive. Similarly, not on all alpha blockers. Give an example where one alpha blocker that cannot be used as an antihypertensive. Alpha blocker, BHP te ki drug use kora hai? Tamsulosin. Tamsulosin, it is an antihypertensive drug. They are very selective for the prostate. But if it is given as an antihypertensive, if it is a alpha blocker, it is alpha blocker, but it is not a antihypertensive alpha blocker. Prazosin is a alpha blocker and it is also used as a antihypertensive. Clear? So sympatholytic antihypertensive drugs. Among these, some alpha 2 agonist that also comes under the sympatholytic one. Next one, methyl dopa, already discussed. They converted inside the brain and they stimulate the alpha 2 receptor, where it is used primarily in hypertension in pregnancy. ঠিক আছে, এগুলো অত clonidine, guanafase, guanafacin, guanabase, all these are alpha 2 receptor agonist acting centrally. এইগুলো তোমাদের লাগবে না। ভেসোডাইলেটর হাইড্রালাজিন হাইড্রালাজিন কি করে? ভেসোডা কোন ভেসেল? না আর্টারি না ভেন? মেনলি আর্টারি। মেনলি ভেন কে করে? মেনলি ভেন ডাইলেট করে নাইট্রেটস, আর দুটোই ডাইলেট কে করে? নাইট্রোপোসাইড। ইউ হ্যাভ টু রিমেম্বার, ভেসোডাইলেটর, আর্টারিওলার ডাইলেট হলে কি হবে? there will be a reflex tachycardia. Reflex tachycardia, what is the difficulty? Reflex tachycardia hole that can be for few time that increase the blood pressure as well as more than blood pressure, they can increase ischemia. Oxygen demand in the heart will be high. So there may be some situation when we have to use some arteriolar dilator with a beta blockers. Why? Beta blocker will block the sympathetic stimulation which is caused by the reflex tachycardia. ঠিক আছে? সুতরাং if we have to give the primarily arteriolar dilator and patient has a history of ischemia, so we have to give a beta blocker along with. Why? To prevent the hydralazine primarily dilates arterioles. Clearly, minoxidil similarly they also dilate the arterioles. If there is arterial dilatation, there will be peripheral resistance will be less and there will be reflex tachycardia. Minoxidil acts through the potassium channel. It opens the potassium channel by modulate the ATP type of ATP mediated potassium channel. So name some other drugs that can also act in a potassium channel. Potassium channel. Endocrine পড়ানো হয়েছে? Insulin, sulfonylureas, they act through the potassium channel, but they block the potassium channel. Here they opens the potassium channel. Sodium channel block কে করে? কয়টা ড্রাগের নাম বলো? Sodium, they block the sodium channel. Lignocaine পড়ানো হয়েছে? হয়েছে তো? Phenytoin, তারপরে valproate, all these block the sodium channel. Potassium channel open কে করে? Minoxidil. আর কে ব্লক করে? সালফোনিউরিয়া। ঠিক আছে, এগুলো মনে রাখতে হবে এমসিকিউ পারপাস। সোডিয়াম চ্যানেল ওপেন কে ব্লক কে করে? পটাশিয়াম চ্যানেল ব্লক কে করে? পটাশিয়াম চ্যানেল ওপেন কে করে? ঠিক আছে, এগুলো নিয়ে অত। সোডিয়াম নাইট্রোপোসাইড ইজ অ্যানাদার ইম্পর্টেন্ট ওয়ান। Sodium nitrophospate used in hypertensive emergency. It dilates both artery and vein by releasing nitrous oxide. Nitrous oxide is released from where? From endothelium. It acts where? In smooth muscle. এই কথাগুলো মনে রাখতে হবে। কি হবে? They release nitrous oxide from the endothelium. Release হয় endothelium থেকে, আর they act where? The vascular smooth muscles, and they dilates both arteriolar dilator and venodilator. They used intravenously in case of hypertensive emergency. Hypertensive emergency কখন হয়? 210 ওপরে। And what is the why we give these drugs intravenously primarily? না, intravenously কেন দিচ্ছি? যে to prevent emergency end organ damage. কি end organ? Brain, heart, kidney, eye. ঠিক আছে? আর কি ড্রাগ দেওয়া যায় নাইট্রোপোসাইড ছাড়া? ফুসেনামাইড আর না, লুপ ডাইরেক্টর অফ ফুসেমাইড নাকি না আলাদা বেরিয়েছে? আর সাবলিঙ্গুয়াল নিফেডিপিন, আর আগে ভেনাস গুলো মানে ইন্টারভেনাস গুলো বলো। এনারাপ্রিলেট, নট এনারাপ্রিল, ইট ইজ এনারাপ্রিলেট। ক্লিয়ার? আরেকটা ড্রাগ দেওয়া যায়, দ্যাট ইজ নাইট্রেটস। If we can exclude there is a no hemorrhagic type of severe. ঠিক আছে, তাহলে অ্যান্টি হাইপারটেনসিভ এর মেইন জিনিস যেটা, হোয়াট আর দ্য প্রাইমারি অ্যান্টি হাইপারটেনসিভ? ফার্স্ট লাইন অ্যান্টি হাইপারটেনসিভ, এসি ইনহিবিটর, এআরবি, ক্যালসিয়াম চ্যানেল ব্লকার। কোন টাইপের? ডাইহাইড্রোপাইরিডিন গ্রুপ অফ ক্যালসিয়াম চ্যানেল ব্লকার। এন্ড ফোর্থ ইজ এ ডায়োরেটিক, হুইচ টাইপ অফ? থায়াজাইড। সেকেন্ড হচ্ছে which drugs are primarily used pregnancy, hypertension in pregnancy, and which antihypertensives are contraindicated in hypertension in pregnancy. Clear? Third one হচ্ছে what are the drugs commonly used for hypertensive emergencies? Clear? What are the different routes for hypertension? Primarily antihypertensive given in which route? Oral route. In hypertensive emergency it is intravenous and sublingual. Clear? তারপরে ফার্স্ট লাইন ড্রাগ, সেকেন্ড লাইন ড্রাগে how it can act as an antihypertensive. এটা মনে রাখো। How beta blocker acts, how alpha blocker acts as an antihypertensive. All You have to remember for MCQ purpose, not all alpha blocker or all beta blocker. Similarly, all calcium channel blocker, all diuretics are not used for antihypertension. Suppose mannitol, it is a diuretics, but it cannot be used in hypertension as the antihypertensive drug. Clear? But most of these ACE and ARB can be used as antihypertensive. Clear? এই পর্যন্ত? Then হচ্ছে কোনটা arteriolar dilator and arteriolar dilator, what are the side effects? It is, primary side effect is the reflex tachycardia can be there. Postural hypotension is caused by which type of antihypertensive? Alpha blocker. They causes postural hypotension. Similarly, nitroprusside, how it acts, where it can be used, and nitroprusside also you have to explain why it always inside a what is this? Out from the sun, because or it have to cover with a black paper, because if it gets this sunlight, they degrade and so their efficacy will be less. Clear? Alpha blocker, beta blocker, alpha plus beta blocker. Mechanism of action, ACE-ARB mechanism, calcium channel diuretics mechanism as an antihypertensive. Not only the mechanism of action as an antihypertensive. We have to remember, because beta blocker is used in hypertension, it can be used in angina, it can be used in heart failure, it can be used in arrhythmia. But mechanism of action of beta blocker as an antihypertensive is different from the mechanism of action of beta blocker as a antiarrhythmic or as a anti-anginal drug. So, how it acts as a antihypertensive?